Hello, Navneet. Now let us review your case history. Begin from the top. Okay, so heading right. Department of surgery. Good. Passport data. So we have name, gender, age, marital status, city, address, time and date of admission. Yes, very good addition. Who conducted the admission? Very useful. Principal diagnosis. Yes, lumbar spondylosis. It would be better if you could show us the grade. You could use also some classification if you want to point out already the principal diagnosis. Complications, pain. Pain, that's not a complication. Pain, that's a symptom. If you want to say that this disease is complicated by pain, you can write down that there is a pain syndrome. See? Pain in the lumbar region, which irradiates somewhere to L5, L4, kidneys. That's not a complication, that's a symptom. So you don't write symptoms in this part. No concomitant disease, okay. Curator, great. This goes for page 1. Now we have to switch to page 2. Okay, so chief complaints. Pain at the back, near the lumbar region, which radiates towards kidneys. Yeah, as a descriptive word, that can go. So major complaints and secondary complaints: weakness at lower extremities, muscular spasm. That's good. Now here there is crucial mistake, because this is not what you write down in the second part of case history. This is what goes at the objective. In this part, after complaints, you have to write down this part, anamnesis of the disease. Here it goes, right here. So symptoms started at that date. Acute attack. Acute attack of what? He has lumbar spondylosis. How do you know that? You only started gathering anamnestic data. The cause of disease is the defect in L4, L5 vertebrae, transverse process enlarged and compressed. So this is pathogenesis of the disease. This is what you have to write after everything. This is not what you write in the anamnestic part. Once again, anamnesis is the stuff that the patient tells you. It can be, of course, that if the patient, he has some medical education, he comes to your hospital and says, oh, you know, I have this pain between L4 and L5, my nervous roots of lumbar plexus are compressed with some vertebrae or something, but that's not what patients usually tell you. They just say that my back hurts somewhere in here, and shows with a hand. So you don't write that in the anamnestic part. No effective treatment. That's not about complaints. Treatment should go to no treatment. Yes. Only yoga is effective. Yes, that's a good point. You can tell that the patient tried some alternative methods of treatment and they are ineffective. Ultimate and final. That's not what you write down here. Here you're talking about patient's complaints. You don't know exactly what is his diagnosis. Once again, from these lines, everything you know is that this patient developed pain at his back, and also he has weakness in lower extremities. That's everything you know about his disease at that point. How can you tell that the ultimate treatment is surgery? This is crucially incorrect. Location of pain is lower.
You know, love is an incredible thing, and we don't know
yes,
love like we should.
Say where the pain is located exactly. Allergies, season allergies, infectious diseases in the past. That's what goes here. The anamnesis of vitae. It's not what you write in the block of general complaints. I don't know what is this abbreviation. If you write some abbreviations in your document, for example, case history, you must give a description. When you mention it first and next, you can use the abbreviation. But first time you always have to give the description of any abbreviation. So this is also a mistake. He takes a lot of analgesia, relaxants. Yes, this refers to the anamnestic part of the disease. The patient tells you that pain can be relieved for some short period of time by some drugs. You gather the information about those drugs in this part. Tobacco smoker, cigarettes, alcohol. This goes to this part, the anamnesis of life. His smoking doesn't have any direct relation to major complaints. Maybe this pain is slightly relieved by tobacco smoking. If so, yes, it can be here, but as general information, no, this doesn't go here. Next, you give objective data. That's not what goes next. Next goes the anamnesis of life. That's what goes next. So let's see, family history, no hereditary diseases, very good. Social history, yes, you give the occupation. Professional harms, he sits table for a long time. He has no income, yeah, that's very bad. He doesn't have income, but I don't really understand what it has to do in here. Maybe you wanted to mention that he doesn't have medical insurance. This may be important. Okay, next, after this, you go to physical examination part. So we've talked once again that this is not from here. Okay, let's leave it here for a second. General conditions satisfied, yes, good. Body temperature, yes. Patient is lying straight, yes. The patient posture described, very good. Face expression, anthropometric data, BMI. You have to write down exact number of BMI. Salt. How do you calculate BMI exactly? So it would be good if you count it. Skin is of normal color, lymph nodes. What do you mean by that? What all reflexes? There are hundreds of described reflexes in neurology. Do you mean that you've checked them all? All reflexes which are known? I don't think so. So don't write what you don't know. Oral cavity has no infection. How do you know that? Did you perform him microbiological examination? Or you have installed microscope in your eyes or what? You can't tell if his oral cavity has or has no infection. Every healthy person has millions of germs inside his oral cavity. So every living human has oral infection. If you want to mention something specific, you should have written it here. When you're talking about, when you're describing physical examination, you give objective information. All complaints were given here. Everything as a result of your interrogation with the patient was given here. Next, it's objective investigation. It means you don't talk about complaints anymore. So, description of pain in the musculoskeletal system section is wrong. You don't talk about that, this section. Head has normal size. What do you mean by that? What is a normal size of the head? How did you measure that? What measurement tools did you apply? What nomograms for normal size of the head? Joint? Do you mean some specific joint or all joints, or what do you mean by that? Not palpable. What joints are not palpable? Are they not palpable? Why are they not palpable? It's not very clear. This is something very incorrect here. Okay, eyes are normal in color. Yes, that's good. Scleras, but not eyes, because you know eye is a complex organ. It's not obvious what do you mean by eye color. Here it would be good if you mention scleras, because you can tell about the color of scleras that they are normal color or they are icteric or something else. Infectious foci are not seen. This is a good sentence. Mucous tunic has no lesions. Means that during investigation you don't see any signs of visible pathology of mucous tunic of the oral cavity. This is a good sentence. Teeth, tongue, mouth. Mouth has smell. Yeah, that's actually a very useful symptom. Fungal attack. I don't know what you mean by that. If you mean fungal infection, that's a diagnosis, and you don't write diagnosis in the objective part. Costal angle, good. Participation of chest breathing, no lagging of its half. Yes, that's a good sentence. You give information about some neurologic symptoms. Frequency is normal. Here you have to write down number of breaths per minute. Palpation. Noise of rubbing, it's a sign of which you find out during auscultation. You don't recognize noises during palpation. If you hear something, that's a part of auscultation, so it doesn't go here. Vocal tremor not seen, that's good. Elasticity normal. I don't know this abbreviation. If you mention any abbreviations, you should give explanation. Here there is no explanation, so I don't know what it means. Percussion, sounds, resonate. Normal, we hear clear pulmonary sound. Good, that's a good sentence. Lung limits normal, yes, good. Apex height, very good. This section, very good. Vesicular breathing appears, yes. Both lungs, right? Yes, here it's correct. Pleura rubbing noise is heard. You mentioned that in the auscultation section, and this is absolutely correct. No rails, good. Bronchophonia absent, very good. Cardiac hump not seen, yes, this is a part of examination. Pulsation of apex, yes, bus. This is also a very good sentence. Percussion, yes. When you talk about, oh, this is very right. Beats per minute. Yes, perfect. You distinguish beats per minute from pulse. That's correct. Pulse form. You have to add number of pulse. And if pulse corresponds to beats per minute. This is also a very important part that you have to notice here. value what number the systolic pressure, you have to mention it here. Symmetry, no dilatated veins on the abdominal wall, yes. No hernias, no scars, perfect. Visible peristalsis, not seen. This is an important sign. Yeah. Palpation. Local resistance. Do you mean the muscular defense here, or some resistance of unknown origin? You had to point it out in here, but that's not principle. Sigmoid. Outer 3 of Lina umbilico not clear. Can't guess what is this landmark. I've told in the tutorial video that very important thing you have to write down in the abdominal palpation section is peritoneal symptoms. So here, somewhere in the section of deep palpation, you have to point out that the patient has no symptoms of peritoneal irritation. Of course, if we are talking about neurological and vertebrological case history, that may be not relevant, but still, it would be better if you could point it out. No edema, yes. Negative Pasternatsky sign. Prostate not palpable. Actually, prostate is palpable in each and every man. May say that there are no objective signs of lesion of prostate, but it's palpable always. See, here you point out that prostate is not palpable in the urinary system section, and reproductive system you say that prostate is normal. How can you tell if it's normal or it's abnormal if it's not palpable? This is not understandable. No cryptorchism, varicocele. Over here you also have to point out that there is no signs of sexually transmitted diseases. Not because you're so curious, but because the patient has some signs of sexually transmitted diseases, he must be isolated in one way or another from other patients, and caution must be taken during surgery in the operating room. Because if he has either syphilis or AIDS, he must some epidemiologic measures should be undertaken. Patient is conscious. Yes. Speech and language, motor system. Tendon reflexes are normal. It would be better if you could write down more about what exactly tendon reflexes. spinal nerve. I can't understand what is spinal nerve. And more, I can't understand how can you examine spinal nerve during physical examination. Do you palpate it or auscultate it or what? Babinski reflex negative, very good. How can you tell that all his glands and their function is normal by physical examination? Do you know level of hormones, or do you know that all glands don't have signs of adenoma or inflammation or hyperfunction? You can't know that from physical examination, so this statement has no foundation. You can't say that by just physical examination. You may say that, for example, you don't find some pathology of his thyroid gland during palpation, or for example, he has no Cushingoid signs. So this gives us a small clue that maybe his adrenal glands are normal, but you can't be absolutely sure only using physical examination. On the basis of complaints, yes, here you describe once again the complaints. This sign that the pain is heavy in the morning and gradually decreases in daytime, this occurs first in here. You had to write it down in the complaints section first, because it's seen here, but we don't know where it came from. Anamnesis. What are those dots for? I can't understand. Lumbar spondylosis. We don't know if he has lumbar spondylosis yet. We know that he has some pain in his back of unknown origin. So this isn't from this place. Once again, all those dots, I can't understand what they mean. No previous traumas, yeah, no hereditary disease. Once again, I don't know what is this for. Or you wanted me to write something in here? Objective investigation. Primary diagnosis here. What primary diagnosis? There is nothing in here. Complication. This is pathogenesis. We don't know that yet. I can't understand where this conclusion came from. You do not have enough substance to make this conclusion from this part. He might have lumbar spondylosis, but why can't he have, for example, tuberculosis of a vertebral body? Or why can't he have inflammation of sciatic nerve? Or why this patient can't have myositis or some systemic disease like rheumatoid arthritis, for example, or Bechterew disease, or any other disease which has this similar symptoms. We don't know that. This statement doesn't occur from this information. You don't have substance to make this conclusion. From this, you may say only that this patient has pain syndrome which is located in his lumbar region. This is also accompanied by dysfunction of some nerves related to lumbar plexus, because there is neurological symptomatics, pain in the hips, legs, there is weakness in lower extremities. So you may say that this patient has some neurological disease, name it, and the conclusion is that this patient needs additional investigation to find out what is the disease. Fungal infection in the oral cavity. We don't know that. You don't give any symptom of fungal infection. You just make this statement in physical examination part, and where this statement came from remains unclear. So you can't make this statement in here. Additional investigation. That's all? Seriously? Please tell me that I've got some wrong file. Where is differential diagnosis, treatment section, prognosis? Where are the descriptions of those results? Where is the epicrisis, description of etiology and pathogenesis of the disease? Why don't you give abbreviation once again? I don't know what is this. What is this also? CT. Yes, we know that CT is computed tomography, but this is abbreviation. Why do you administer those tests? What for? What is the purpose of this, or this, or X-ray? Why do you use both CT, MRI and X-ray? You will obtain similar information by those. What is so specific about CT, MRI and X-ray? You do not give the description. Why do you administer those methods? I've told that in the tutorial video. Navneet, this I'm hoping that I've got some wrong file, because this is not a case history. That's 1/3 of a case history. Please watch again all this tutorial I've made for you and write down a good case history.